Coming to the questions of the nerve area. Hyperextension at MCP joint and flexion of the IP joint occurs in the involvement of which muscle? So this is classical of claw hand. They're talking about lumbricals and introstia together. Identify the splint. Now this splint is doing extension of the wrist and fingers. So this is a coccus splint for the radial nerve palsy. Very commonly asked. Roof's test video I told you for thoracic outlet syndrome that came in last AIMS. Allen's test video again I told you came last year. Which of the following can be seen in nerve palsy? Now this is a PGI question. So multiple answers can be correct. So Faber's is lost in nerve palsy. So what movements are lost? Abduction is lost. Externalization is lost. So which of the following can be seen? So abduction can't be seen. Externalization can't be seen. Pronation of forearm, seen. Loss of abduction relation, seen. Loss of sensation on lateral side of arm, seen. So these are seen in os palsy. Which of the following helps to differentiate between high and low radial nerve palsy? I told you brachioradialis, otherwise the clinical presentation is ditto, the same. Middle finger extension test is useful for all except. So the finger extension is a feature of pin palsy. Will pick up the radial tunnel syndrome. Will pick up the tennis elbow because the pain will trigger around the lateral epicondyle, but will not pick up the motor neuropathy. So that is the answer. We'll talk about the tennis elbow in the subsequent lectures. A patient can't extend his wrist, but he has no sensory loss. So he has a wrist drop. Wrist drop, radial nerve, spiral groove. We had a discussion on this question. Most specific test for carpal tunnel syndrome, I told you, direct compression test or the Durkan's test. So this was about the nerve injuries. 3 chapters which are very important for entrance exam. Nerve injuries, arthritis, upper limb trauma. And nerve injuries being the shortest, for me, is the pick. Every exam, you have multiple questions coming from it. Thank you.